The whole issue of health care, this is starting to get very, very complicated, and we've got some members of Congress who, obviously we've got some members of Congress who are just plain weasel on this. The Republican National Committee has issued a memo saying basically use any means necessary to slow this down. The theory being that the longer that they can slow it down, the more the health industry can drop millions and millions of dollars into television advertising, and right-wing talk radio can pound away at this thing to get people to call their members of Congress and so on, and push people away from a public option in a national health insurance program or a national health care program. And there's a difference between health care and health insurance. On the other hand, I had a conversation this morning on AM 620 KPOJ, where I was filling in. All this week I'm filling in for Carl Wolfson from 6 to 9 a.m. here Portland time, with Congressman Peter DeFazio, who's one of the very best progressive members of Congress, a good guy who I have a lot of respect for and has been on this show a number of times. And his concern is that the public option that's being discussed would be based, reimbursement payments would be based on Medicaid payments. And his point is that Medicaid reimbursement is a crazy quilt, patchwork across the various states, that in New York State and in Florida, for example, doctors taking Medicaid get very healthy payments, thank you very much, because in part the amount that a doctor is reimbursed is based on the local cost of doing business. And in fact, it goes back to the 60s. It was based on the cost of a two-bedroom apartment in the 1960s. That's how they calculate what the doctor can charge, what can add to his charges for rent. And today, those prices have gone up dramatically in New York and Florida, but not in Oregon. And so Medicare docs in Oregon are getting very little compared to Medicare docs in New York and Florida, and a lot are simply opting out of the program. And so here we've got a very progressive congressman saying, wait a minute, slow this thing down, let's do this right, which gives me pause. And then Steffi Woolhandler, she's with Harvard University, a progressive. This is from the Institute for Public Accuracy, a progressive think tank. She says, as Washington politicians climb on board a Massachusetts-style health reform, Massachusetts' health care is sinking. Congress seems poised to include an individual mandate in health reform, copying Massachusetts. She says, here in Massachusetts, beating your wife, communicating with a terrorist, and being uninsured all carry $1,000 fines. But reform has not made health care affordable for middle-class families or for the public treasury. She says a middle-income, uninsured 56-year-old is now forced to lay out at least $4,800 for a policy with a $2,000 deductible before it pays for any care, 20% co-pays after that. It's overpriced, skimpy coverage, and this is what has left 1 in 6 Massachusetts residents unable to pay their medical bills last year. Meanwhile, health costs continue to explode. So, stepping into this, Marc Goldwein is with us. He's newamerica.net is the website. And he's the policy director of the Committee for a Responsible Federal Budget, senior policy analyst, the Fiscal Policy Program, the New America Foundation. Can I appropriately call this a conservative think tank, Mark?
No, not by any means. We're very the Committee for a Responsible Federal Budget is very bipartisan. We have Democrats and Republicans on our board. Okay,
and you are advocating that we should have not just a government bureaucracy between us and our doctors, but also an insurance bureaucracy between us and our doctors, if I understand this correctly.
Well, what we're saying is that you can do health reform, and there's a lot of things you can do to fix the healthcare system, but the focus needs to be on reducing costs and slowing long-term healthcare cost growth. Because if you don't get those costs under control, anything we do on coverage isn't going to matter in 10 years because we can't afford it anyway. And secondly, whatever we do in healthcare, we need to be willing to pay for. So that means we either need to have higher taxes or lower spending elsewhere.
But
if we're going to have new entitlements.
Your prescription is for universal insurance through private, presumably for-profit or not-for-profit insurance companies. Do I have that right?
The committee does not have any position on what healthcare reform should look like. Our main focus is on costs and on how you pay for it.
So how do you change costs and how do you pay for it?
Well, the first thing that you need to do is you need to look at our current delivery system and you need to look at our current payment structures and see that they're out of whack. Right now we're paying doctors more money to do more procedures in hospitals. We're not paying them more money for better outcomes.
Sure.
And we also have,
you want to look at the Mayo Clinic model, which works, as opposed to the going back to this New Yorker article, as opposed to the model down in Texas where the doctors own their own imaging centers. And gee, what a surprise! They're sending a lot of people for X-rays.
Yeah, I mean, it's not so simple, and we don't really know how to cut out all the waste of the system. But certainly, the Mayo Clinic has excellent results at low cost, and somewhere we should be
at half
looking.
the cost. They're running around $4,600 a person, if I remember the article correctly. It's been a few weeks since I read it, versus over $9,000 down in Texas. In this community, have you read the article that I'm talking about? Do you know?
Yeah, I have.
Yeah,
I don't remember the numbers, but Mayo Clinic is able to provide excellent health care at a very cheap cost, and we find that other places in the United States and in other countries. But of course, when we're restricting costs, we're making certain decisions about what procedures we're willing to pay for.
But isn't the largest problem here, Marc Goldwein, that we have between us and our physicians right now private for-profit companies that are skimming anywhere from 20 to 50% of all the money off the top so that they can pay their CEOs millions and millions a day. If you took the pay for the top 10 CEOs of the top 10 health insurance companies in the United States, if you just took that pay, and the top one makes over $12 million a year, if you took the pay of those 10 CEOs, you'd have enough money to provide a full year health insurance for 100,000 people based on the cost of health insurance in France. I mean, this is crazy. Why do we have these leeches on our back?
Well, in part, we have insurance companies because we, as a country, are encouraging the creation, and we've encouraged the creation of a system of employer-provided insurance because of our tax code. But I don't think it's fair to say, yes, administrative costs and profits are very high in the private sector. The public sector is by no means perfect. There's plenty of waste and abuse in Medicare.
Medicare is delivering services at 3% overhead.
At 3% by the dollar, not necessarily 3% by the patient. So seniors are a lot more expensive to cover.
Well, of course they are, but they are for private insurance companies. They just drop them.
That's absolutely true, and the private sector obviously doesn't have all the answers. But I don't think we should dismiss its role out of hand, especially in advancing medical technology.
No, I'm all in favor of a private company making my X-ray machine, but it seems like most of the companies that make these things are based in Germany. Siemens is one of the largest producers of imaging technology in the world. We're certainly not making these things in the United States. I'm not sure what that has to do with the debate about how we fund healthcare in the United States. Why is it that we're paying about twice as much for healthcare as any other industrialized country in the world, or a little less than twice as much, and yet most of these other countries are getting the other 35 industrialized countries are generally quite happy, thank you very much, with the healthcare that they have?
That's absolutely true, and part of the reason we're paying more is because we're wealthier, and it's sort of a general economic principle that as people in countries get wealthier, they demand more of the things they like. So part of it is that, but that comes nowhere near to explaining the whole problem. We have a major insurance industry problem, and it's partially because of the structure of the market. Insurance companies aren't able to compete with each other effectively because of the structures we have in place. We also have a lot of unnecessary and, in fact, over-treatment, so much that sometimes we're treating people to the point where we're killing them instead of helping them.
Yeah.
And I'd say the third major point is something that we have to accept is the United States is where most technological advancements occur, and essentially we fund that. We fund the advancement of medical technology.
But we're funding that by, if you're talking about pharmaceuticals, we're funding that through the National Institutes of Health with our tax dollars, not our insurance dollars. And if you're talking about medical imaging, most of that is not made in the United States. It's made in Europe.
No, how I'm saying we fund it
and the American manufacturers, by the way, are doing their manufacturing in South Korea and Japan.
But essentially, we're subsidizing the world's technological advancement because companies who are profit-seeking will come to the U.S. or will want to sell first in the U.S. because they know that in the U.S. they can get their best profits for any type of medical devices, for drugs, etc.
Right, because it's a free-for-all. It's the Wild West. Shouldn't we bring this under control? We the people. I mean, shouldn't we say that healthcare is part of the commons, just like our traffic lights and our streets are, and we're going to have some control over this.
I think we could. I think reasonable people can disagree over the role of the private versus public sector in healthcare, but certainly if we are going to keep a private sector, and the extent to which we are keeping private sector, it should be a properly functioning market, and that means all of our poor regulations and tax subsidies need to better fix that market so that it works right and for the American people.
Yeah, well, as a generality, I can't disagree with that. Marc Goldwein, the policy director of the Committee for the Responsible Federal Budget at the New American Foundation, newamerica.net. Marc, thanks for dropping by today.
No problem. Thanks for having me.
Good talking with you. 16 minutes past the hour. Thom Hartmann here with you, 866-987-TOM.